This is an overview of the Water Sustainability Flagship Project. This is PG co-funding from NRE for the flagship project at CSR level, but in particular the governance and planning component. The aims of the project is to contribute to the equitable, efficient and sustainable use of water to ensure that South Africa attains its national and economic growth and development. This of course is the long-term objective of the flagship project, whereas the short-term objectives focus on water treatment, which we'll get to in a minute. The planning and governance work is particularly related to wastewater treatment works, and the objective is, the issue here is that inadequate strategic, integrated and cooperative governance and planning for water sustainability constrained equitable access as well as sustainable and inclusive development. So this is the issue that we're addressing in the project. The project plan is based on a log frame, which starts on the right hand side of the diagram with strategic program outcomes. These are supported by intermediate outcomes, which are of course derived through outputs and transfer of activities, which is based on R&D activities to the left, and of course in research inputs. Of particular interest for us in this project is changes in knowledge, attitudes and behavior of planners, water users, including effluent discharges and authorities in terms of practices, procedures and policies. The project partners in this project is firstly internal in terms of the CSR flagship, being built environment, CAS, mathematical and digital sciences and biosciences. We also have external partners being Limpopo government in terms of the Sekhukhune case area, Limpopo University also being active on the ecosystem side in the Williefontein River, as well as the University of Witten, who's also doing an integrated water resources project in the Middle Williefontein, and we're also cooperating with them on that project. If we look at the finances of the project, of course CSR co-funding is set at 750,000 for this year, 650,000 for next year and 550,000 for the third year of the project. The SRP project, what's termed SRP co-funding for the flagship was set at 3.3 million for this year, 2.5 million for next year and 2 million for year 3. If we just look at the project, what are the issues there, or the problems that we're addressing, is that human waste reduces security of water quantity and quality, as mentioned earlier. The societal problems here relate to economic development, in particular industry and agriculture, social development in terms of urban supply of water, as well as human health, particularly downstream of these works, and environmental sustainability, particularly referring to ecosystem condition. The proposed research will help alleviate this problem through addressing the causes in terms of human settlements. That's the upstream work, which is done through built environment. The issue of improving wastewater treatment works, which CAS is working on in the flagship project, and then governance issues, which is really a partnership between NRE and built environment. And then of course, in particular in this part of the project, we're interested in downstream impacts and options, and that's focused on by NRE. And of course, why should we be doing this in the first place? This is to deliver the value of existing research in addressing a national priority. The planned impact of this project can be looked at in terms of a short-term benefit. This would be the pilot scale implementation of solutions in year 2 of the project, which is next year, and the rollout of these solutions into other areas in year 3 of the project. In terms of packaging these results, this is an ongoing process throughout the project, and I'll give some examples as we go on. And in terms of stakeholder engagement here, it's all the stakeholders that are related or associated with wastewater treatment works. We've done this through the CSR conference, through popular media, meetings, workshops and scientific publications. One of the examples is a user-friendly report that was produced in partnership with a visiting researcher from France, where we've actually summarized all the technologies that are available, both from a sanitation perspective as well as a sewage treatment perspective. And this was packaged in a glossy A3 format, which is then easy to discuss with stakeholders and also to evaluate different options. We've also been communicating the objectives and the interim results of the project. This is an example of the exhibition that we had in the Williefonds River Forum Conference. We both gave some background in terms of what NRE is doing, but also provided some maps of the case area, indicated where these water treatment works were, and also highlighted the upstream and downstream issues related to that. There was certainly a lot of interest generated through this, and we made quite a few good contacts that will help us in the project. So the research questions that we need to address in this project. It's to say, how can knowledge and technologies be integrated into a spatial-based risk platform to assess, prioritize and mitigate the impacts of wastewater treatment works on ecosystems and human health? And that's particularly focusing on governance, policy, downstream users, particularly human health, ecosystems, using an ecotoxicological approach, and then also using a catchment approach to understand the issues in a broader context. If we just take an overview of project deliverables, we've got a progress report that is due in January. That will report on the status of development of new technologies. We're planning a conference paper with initial findings, which I also referred to earlier. Again, a progress report in 2014, and also some scientific outputs, of course, after we've done the pilot scale implementation. So what are the key findings or messages emerging from this research? Well, firstly, we can think about the percentage of people in Sekokune that's connected to wastewater treatment works. And if we take that away, we'll see it's only 2.5% of people that are connected, which impacts quite significantly on the project execution. The second point that's quite clear is that wastewater treatment works operate at roughly 3 times their design capacity, which really means they're not effective at all in terms of dealing with sewage waste. Future planning is typically for waterborne sewage, so that's what if we look at the development plans, but there's little investment in infrastructure to support these developments. As I've also indicated in the earlier user-friendly document, that some of the alternatives seem to be attractive. What we've also found is that government spheres and departments are not synchronized, both horizontally in terms of between different departments, but also vertical in terms of national government versus provincial and local government. What is clear is that inadequate management of human waste has a significant impact on economic development, health and the environment. If we just look at our planned and actual progress against major tasks, we can see that everything is pretty much on track. The project did get off to a slow start in terms of just getting all the administration in place, particularly for the CSR level flagship funding. But at this point in time, everything is pretty much on track. We also see here from 1.5 to 1.9, those are essentially activities that are linked to this project, but not necessarily funded through this PG co-investment. If I just look at the project finances, this is dated 1 October. The planned HR was 390, planned running 30,000, with a total of 420,000 planned to have been spent on 1 October. The actual is that we've actually spent a little bit more on HR and less on running, although the running cost has to date been carried on the flagship project and not in the co-funding. This will probably change over time. But the project is pretty much on track, slightly ahead, but I would suggest that it's pretty much just on track. So if we can look at some highlights or issues that we may be worried about, I think the one thing that we found quite useful was this collaboration with built environment, with biosciences and with MDS. Certainly I think we're building relationships there, and that will certainly help us in the project. At this point in time, we think we've got a good characterization of the problem. We've identified the key issues, and we're in a position now to start to look at solutions. And some of the problems that we've had, I've referred earlier around the funding, CSR level funding of the flagship. That administration is causing some uncertainty at times. And then also, although it's been booked to the flagship project and not to the co-funding, the running cost is higher than what we expected. And then just some pictures of to illustrate what's been happening in the project. Firstly, we can see clearly that in some of these areas in Sekhukhune, people are still dependent on water directly from the river in terms of potable water household use. And we found some guys that were collecting water and then they were selling that in the communities. And this is, of course, also downstream of treatment work, so there could be health issues involved. This is the Steelpoort treatment works, pretty much in disrepair. Some significant problems in terms of water quality coming out of this site. This is one of the irrigation dams that we also suspect is getting some sewage effluent into it, and of course there could be some health issues and as well as some economic impact if exports are impacted on by this. And lastly, some algae in a river that's also caused by treatment works.